So hi everyone, I'm Colleen Trotter. I'm a third-year medical student at Keck School of Medicine working with Dr. Gorlitsky, and today we're going to be talking about sleep. And I don't know about you guys, but when I am having trouble going to sleep, this SpongeBob meme kind of exemplifies how I feel when I'm struggling to sleep. Next. Okay, great. So when I was structuring the presentation, I just kind of thought to structure it in questions. So the first question that came to my mind when I thought about sleep disturbance was, am I the only person who can't sleep? You might be feeling like that. And the answer is no. So the American Sleep Association reports that between 50 and 70 million Americans can have trouble sleeping. And those problems can range from insomnia to other common sleep disorders like narcolepsy, restless leg syndrome, REM sleep disorders, and obstructive sleep apnea. And it's not just a problem in America. There was a study that compared sleep disturbance in the US compared to residents in Hong Kong, and they found that the rates of problems with sleep were pretty similar in both the communities, with an average of 12.9% of population having a hard time falling asleep, 28.3% reporting a hard time staying asleep, 20% having a hard time with waking up earlier than they want to, and 8% finding their sleep is just not as restful as they want it to be. So now, I'm sure everyone's heard the term insomnia. So what is insomnia? So it's basically you can't fall asleep or you can't stay asleep. And according to the DSM, which basically defines psychological disorders, it's defined as a difficulty falling asleep, staying asleep, waking up too early, and non-restorative sleep that occurred for greater than 3 days per week. So what's the science behind insomnia? Why do some people have such a hard time falling asleep? So the science shows that people with insomnia are physiologically just more active. Their heart's more active, their metabolism more active, their EEG waves have a higher frequency, and their hypothalamus, which in terms of sleep is in charge of regulating our circadian rhythm, which is basically our routine of when we wake up and when we fall asleep, kind of based on sunlight. Their hypothalamus is less active. So they have a hard time shutting down their arousal and regulating their sleep schedule. In addition, they have a lower hippocampal volume, and the hippocampus in terms of sleep is in charge of participating in forming our memories and consolidating our memories. And even when they studied in healthy people, if they artificially increase some of these physiologic factors in healthy people, it ended up leading to worse sleep. So this interaction kind of goes in both directions. So what are some factors that contribute to poor sleep? So there are some things that you just can't change. As you get older, people tend to wake up earlier and take more naps during the day and overall sleep a shorter amount of time in general. Females tend to have a harder time sleeping. People with a family history of insomnia, if you tend to be a light sleeper, and also some of it may have to do with your genetics. There are some genome-wide association studies that have identified some specific genetic loci that are associated with poor sleep quality. And coincidentally enough, these loci overlap with specific genes that are found to be related to depression, anxiety, type 2 diabetes, coronary artery disease, and overall people who report a low subjective well-being. Other things that are associated with poor sleep are depression and anxiety. People with insomnia were 9.82 and 17 times more likely to have depression and anxiety, respectively. And the more severe depression and anxiety, the more nighttime awakenings have been reported for those patients. In addition, certain other psychological disorders like substance use and PTSD, especially PTSD with nightmares, tend to be associated with poor sleep. And also medical conditions like lung disease, where you have complications with your breathing while you're laying down, can cause you to wake up many times during the night. In addition to having like constriction in your lungs and being on respiratory stimulant meds can also lead to disruption in your sleep. Hypertension, diabetes, chronic pain, heart failure, and rheumatological diseases are also some other medical conditions that are associated with poor sleep. And also just some other sleep disorders like restless leg syndrome and obstructive sleep apnea can contribute to poor sleep as well. So And so in the literature, some other things that have been described as the impact of poor sleep are people report decreased quality of life, decreased decreased cognitive function. They subjectively report that, but it's also been shown that people they tend to inflate how much it actually impairs their cognitive function. It's associated with risky behavior, associated with using kind of addictive over-the-counter sleep meds and alcohol. It's associated with increased suicidal thoughts, and risk of hypertension and heart disease, kind of modulated by elevated sympathetic nervous system activation. So what do you guys think are some misconceptions about sleep? Can you guys think of any? The main one that I can think of is alcohol helps you sleep, which is a misconception because it might help you fall asleep, but it definitely leads to more nighttime awakenings at the end of more nighttime awakenings. And maybe we can come back to this at the end to just talk about, maybe we can like debunk some of those sleep misconceptions. So this is kind of like probably the most important part. How can I make my sleep better? We just spent a long time talking about all the things that lead to poor sleep and the impact of it, but how can we make it better? And so what we described before about the risks of poor sleep, some of them had to do with comorbidities or some other medical conditions that were contributing to the poor sleep. And so it's really important that if you're not sleeping well, and it could be due to like a medical condition or a psychological condition, that both of those issues are addressed. You can't address the sleep without addressing the depression. You can't address the sleep without addressing the lung disease, for instance. Also, one of the main treatments is cognitive behavioral therapy, which the crux of that in terms of sleep is sleep hygiene education. And so some pearls from kind of sleep hygiene education are trying to make sure you go to bed at the same time every day and waking up at the same time every day, even no matter how much sleep you've gotten. Also, trying not to oversleep. Get out of bed once you feel rested. Also, if you're laying in bed and you can't sleep, sometimes you can kind of make an association between the bed and not sleeping. So you're kind of it gets to the point where people are dreading going to bed because they're just imagining that they're just going to be alone in bed, thinking and not being able to sleep. So if you can't sleep, get up, go do something different. Dr. Gorlitsky suggested Duolingo, or learning a language on an app, could be a good distraction. It's kind of repetitive, and you can kind of do that and learn something before you fall asleep, until you're able to fall asleep. Also, another thing is to avoid caffeine after 10 a.m. I know I personally am really sensitive to caffeine, even in tea. And so avoiding caffeine after the morning time can kind of help you be a little bit less awake when it comes time for bedtime. Also, exercise can really help with improving your sleep, but try to exercise during the day and not within the 3 hours before bedtime, because that can kind of when you exercise, it gives you energy, get your endorphins going, which is kind of counterproductive when you're struggling with sleep. Also, considering avoiding screen time late at night can also help you be able to sleep a little better. Another thing Dr. Gorlitsky told me about is progressive muscle relaxation, which I've never done, but you kind of, it works like you kind of focus on, contracting and then relaxing your hands, contracting and relaxing your arms all the way down your body. And so your full body is completely relaxed. Those are just some examples of things that you can do to help you sleep in terms of sleep hygiene. In addition, there are certain medications that you can use that can help with sleep and also can help with nightmares. So you can talk to your doctor about those things. But in terms of medication, something that you want to avoid are benzodiazepine medications. They're quite addictive and don't tend to help with sleep. And so I was wondering if you guys had any ideas on things that help you sleep when you're struggling outside of what we've already talked about, or co-signing like, oh yeah, I was drinking a lot of caffeine and I stopped and it really helped my sleep. My ideas are things that have helped me sleep in the past were kind of the sleep hygiene things that we discussed before. No caffeine really whatsoever for me. I don't even drink caffeinated tea because I'm very sensitive to it. Something I also find to be really helpful, especially if I do wake up in the middle of the night or I'm having a hard time sleeping, is at least at the beginning of COVID, the app Headspace was free for all LA County residents. And they have they have things called sleep stories and sleep music and some like relaxations. Like you woke up in the middle of the night, play this. And I'll play those before I go to sleep. And I find those particularly soothing and kind of almost like white noise. And sometimes they'll even lead you through like guided imagery or guided meditations that really help to take your mind off whatever you might be thinking about and kind of focus on, floating down a river in a canoe and whatever, the kind of the guided imagery of it. Finally, meditation, kind of journaling, affirmations, relaxations before bed, kind of ending my night on a positive note are things that I've found to be helpful for me in terms of sleep. And thank you guys so much for listening to this presentation.